Hopefully, you'll be able to find somebody who's done one of these things, and it really should be one person for one of the squares. And the idea then is once you've identified the person with that trait, that characteristic, then you need to ask them a couple of questions. You need to find out, again, who they are, where they work, what their role is, and then you need to ask them what they may have learned or done a little bit better, and they hear about something that they're doing in their practice or in their organization that is of interest to you and yours, and vice versa. And if it isn't that clicking right there of interests and aligning some of those efforts or those goals, what we'll do afterwards is gather some of those interesting things, and maybe you'll hear other stuff that'll be of interest to you. Because one of the things that we want to do today is really learn how things are going for you. We've looked at the survey that we asked you guys to fill out. We've noticed some areas where we might want to focus next year. And so both in this little exercise and toward the end of the meeting, we really want to hear from you what you'd like us to be working on and focusing on in the coming year. So that's a big part of all of this. So all right.
We have some people on the phone.
Oh, great. Okay.
So Debbie, would you like to introduce yourself?
My name is Debbie Moore. I'm a pediatric nurse care manager with Select Health.
Okay. Welcome, Debbie.
Melinda.
Hi, I'm Melinda. I'm the care coordinator at Utah Valley Pediatrics Timpanogos office in Orem.
Great, thanks, Melinda. And Taylor.
Taylor, can you introduce yourself? Well, unfortunately, our remote attendees can't play the game, so they have a few minutes to relax or whatever, grab some breakfast. But anyway, yeah, Linda. That would be the preference. Hopefully, we have enough here, and and if we need to get creative, we'll figure it out. But let's start with the idea that one person, one answer per square. And it's 3 per square. ABC. So the ABC that we're asking you to fill below is their name, where they work, and the thing that you found out about them. So, all right, you're off to the races. Folks on the phone can hear a little bit better, I hope. So, all right, so I heard like 5 bingos. How many got bingo? 1, 2. Oh my God. All right, I'll start here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 11. Okay. Well, that's excellent. I have 11 books. So unfortunately, you may not get your first choice, but I think they're all good. I think they're all good. So there's 5 different ones, I believe. So this one's called Spark. It's the revolutionary new science of exercise in the brain. I really like this one. That was a personal choice I put in that one. I've read it. It's great. This one is Daniel Pink's Drive, The Surprising Truth About What Motivates Us. This was supposed to be really great, and I think it's going to be useful for ourselves and people you work with and are trying to motivate. This one is called The Checklist Manifesto. I don't know if anyone's read any of Atul Gawande's books, but this one kind of rocked my world when I read it. So it's a fast read, too. Another prize. Let's see, that's 3. Okay, this one is another, well, this is Daniel, I don't know how to say his last name, Kahneman, and Thinking Fast and Slow, so this is a little bit thicker. But this one talks about how our brains kind of work in 2 different modes, and sometimes we need to stop doing that fast thinking mode because it gets us to the wrong place, and to learn a little bit more about what the slow thinking mode is and how to begin to practice that. And then finally, one that looks like Drive, but is not, is called Brain Rules, 12 Principles for Surviving and Thriving at Work, Home, and School. So I have not read this one yet, but it got very high ratings, and I want to read this one. So like I said, I have 11 of those. So if you guys wouldn't mind coming up and grabbing one, I'll go get the rest. And then we'll talk a little bit about what you learned when you spoke with your fellow UCCCN members in this exercise. So please, if you're a keynote person, go ahead. Because I put that in at the end. Well, you couldn't all be. All right, now show the others. Oh, I know. Yes. Okay, so while they're finishing up here, who heard something interesting while they were doing this exercise? Anyone? Anyone hear what somebody else might have put into practice or might have learned in the last year or so? Something that their organization is doing that you could potentially learn from?
Well, I've heard a couple people say that they're more familiar with navigating through the medical home portal, and also heard a couple of times the collaboration with other resources and the knowing more resources.
Oh, that's great. Okay. Curious about the collaboration with resources, that they've connected with people that are actually continuing to work with them or organizations. Is that how you interpreted that?
That would be speaking from me.
Okay,
yes.
great. Great. Oh, that makes me really, really happy. Yeah. Fantastic. Okay, anyone else? Robin?
This isn't new, but I've heard it from several people, so obviously the nurse. How much they're finding it useful and rewarding to work with those families. So getting them involved at the very beginning of the
Oh, that's great. Okay. I can only agree that that must be the case, and now have that good experience that many of you do, but that's really the point of all of it, isn't it? So I'm sure that's very rewarding if you can have the tools and the things that you need to give them what they ultimately need. So much better.
We can make some old resources that are really improved now. But Eric, I have talked to him on the phone on forever, and finally did each other face-to-face and know that what he's doing can help our practice.
That's great. Yeah.
You knew I was so good looking.
No, I think that's really true, and that's been one of the things that I think has been surprisingly wonderful about how this organization has grown over the past year. So when we began this, when we actually were putting things in place last November and December in anticipation of rolling this out, we really were thinking about practice-based care coordinators. And that was who we thought we could connect with, who we thought we knew, and who we felt like we sort of understood, right? And so it made sense to start there. But what happened is kind of just through natural processes, it's grown. It continues to grow. We have different kinds of folks attending. And I think we're learning as a result of that from one another. And so we've been really pleased about that. And hopefully you can make those connections and understand how one another can be of value, right? So yeah, that's entirely the goal. Anyone else? That's okay. I don't mean to put you on the spot. One of the reasons that it's okay is that we are a little running out of time, but I want to talk with you a little bit about this idea of an online. Oh, I'm sorry. Oh. For those who are on the phone, we're just laughing because somebody was talking about all of the organizations that Dr. Norland oversees being the way that they bring things, and so that's a plug for Dr. Norland. And the laughter was because he's sitting right there. So, yeah. Okay, great. So we've mentioned this online forum idea a bunch of times. One of the things that I have struggled with is the term online forum. To me, that doesn't elicit any concept of what that is. Those words don't have a lot of meaning for me personally. But the idea of the forum, for lack of a better term, is that we are hoping to give you guys a place in between meetings to connect with one another and to find out what you can do for each other, what you know, or somebody else knows that you don't, to find out when the meeting is and where the meeting is, to look back and see what somebody else has talked about before. You got a little tickler in your brain, but you can't quite remember what that place was they referred to, what that issue was they were having and got resolved. Those kinds of things. But maybe the biggest thing that we know you'd like to do, we think we know you'd like to do, and we want to make easier for you, is to connect with one another directly. And so what we've been working on is putting together something that is both secure, so your information will stay private if that's how you want it, but also allows you to see one another's information if you set your profile, your settings, so that someone can message you from within the application, or they can get access to your email or your phone number and make a connection that way as well. And so that's something we've been working on, and that's what this link is right here. I'll pop out here and show you. And so I've been working on this quite a bit. I have a document all ready to go that that will show you how to register and log in and use this, but I'll be honest, one of the things that I found as I've worked through it is that it's one of those things that has a lot of bells and whistles, more than you need probably. And so it's been kind of an exercise for me as the person who would administer and moderate this to learn how to do that. And I wonder if that might be something that would impede your desire to use it as well. So I wanted to show it to you briefly. And so this would be kind of what the first page would look like after you've logged in. And so these big bars right here are the area where you would actually post or read and reply to somebody else's post about, for instance, you know, a case that you're having trouble with. And so they're called boards. I'm sorry, this computer is new to me, and I'm struggling a little bit with this. So they're called boards, and then within those, so you've got these overarching categories, and then within them you've got specific boards that allow people to, for instance, talk about more specific things, and then you're able to go back and find things based on that topic, that reply, and so forth. And so you can start a new topic within a board here, or you can just reply to one that's already in place, so that you can reply right here. So this is me playing around in here. Our next meeting will be held on December 16th. It should be lots of fun. We hope you can make it. And then you could come up and say, I didn't make it, when will the recording be online, those kinds of things. So that's something that this offers. I'm going to be really quick in this. I want to show you a couple of the other features. So we've got a calendar, and this would be an opportunity to certainly get the UCCCN meetings posted and information about them, and any other events that we're aware of that might be of value to you could be posted here. We also, this is where you can view members. And as you can see, if they've activated their personal email address, the email address that you would get to contact them through outside of this application, then you can click on that and actually email them through this. There would be other ways of getting information about them as well, and messaging them. So here's where you can message them right within this application, if you will, where you set up your settings and put in your information about your username and password and all those kinds of things. So those are probably the main features of this. Certainly search, we'll look through everything that's in here, but back to, for instance, those boards. This is where you'd be able to reach out for help to the entire group. And you set up your notifications so that if you don't want to have this open and you don't want to be paying attention to it all the time, you'll get a little email notification through your normal email channel when something's been posted, or for instance, at the end of the day, you could just see anything that's been posted, you're getting that little notification email. So that's an option. And the reason that I went with this one initially is because it does have the ability for me to know anything that's happening. And so in order to reduce the chances of PHI going on in here, I would see every post before it got put out to the group. And I don't anticipate any problems, but that's just to be on the safe side. So that is definitely an option. I have recently been made aware of a very lightweight kind of thing very much like this that I think has fewer features, but it's more like Facebook in how it's kind of presented. So if you're a Facebook user, I think it would feel very comfortable in how things show up and how you can search for them and how you can respond to them. And it does have the calendar feature. It does have many of these very similar features. So I wonder if you'd be willing to give this one a try and give me real feedback, like I didn't like it and I'm not going to go back, or it's okay, I struggle with this a little bit, or this is pretty easy and I like it. If you would be willing to do that, that would be very helpful. But we want to be agile and we want to try and meet your needs. So if I get real, honest feedback that it's not working very well, it's a little unwieldy, then we can look into other options that may do a little less but may be more user-friendly. So this information will go out in the Resources of the Month email. And I would love it if you guys would help me out by spending a few minutes on it. And like I said, I have a document put together that has all of the steps on it. It does require yet another email and password, so I apologize up front about that. But I'd sure like to see if this might provide us an opportunity to connect in another way, kind of free of time and space outside of these meetings. So, and I think I could be wrong, but I think that you guys having the ability to see one another's name, role, email address, phone number in a secure place, and that's something that everyone can set at their own discretion. You know, it wouldn't be the default would be to opt in, not out, but that I think would be a really valuable tool. All right. So with that said, let's keep going. Now let's do our brainstorming. So I'm hopeful that we can still do a brainstorming session today. So if anybody has a case that they're having some difficulties finding resources for, and this is your opportunity to bring that up, folks on the phone, thanks for you guys. If you found a fabulous new resource, we always love to hear about that. This is a great time to share those kinds of things too. So I'll just put it out to you. You're welcome to speak up if you have any of those kinds of things going on.
So, Hopeful Beginning is through for Medicaid members. Yeah. Yeah, it's for counseling. It's called Hopeful Beginnings, and it's for our Medicaid population. They go through Optum, and this is sent down to Valley Mental Health, but they will do in-home assessments. And if they find the need, they will continue to come in-home for counseling until they, can get them to adhere to going to services outside of the home. But to get them to understand needs for counseling, they're going in the home. That's really great.
That's a resource that you can refer someone and you will contact them,
well, you
they're have to contact you and agree.
So I have made the referral, but I had spoken with the parent that the parent was willing to have the teenager begin with. So the teenager wasn't in agreement, but the parents were. So there's an intake number that I can get over to Mindy, and you call and make that referral, and then they will call into the parents to go.
That's one thing I called the number yesterday because on the website it wouldn't verify it. There's an option to send a form, an intake form, and I was told I asked if I could take it to the parents to fill out and we could practice them, and I was told not to do that, to have the family location call. And ask questions on the phone and do that, do an intake that way.
So it'll go either way, where we'll call into the parents and get the information.
Yeah.
But all I had to do was make the initial intake call, give the rapid contact, and then they do it up.
Is there a website for that program?
I wasn't.
Yeah, that's where they have a printable intake form.
Anyway, I hope it keeps going. It's pretty great.
Excellent. They also do wonderful behavior management strategies and family paths.
Great.
Are these guys down in Utah County too, or is this just Salt Lake
Is
County?
it just Salt Lake County?
We were able to get somebody that's in Davis County in that, but I don't know if they do take that or sometimes.
Okay. Yeah, that's for sure. I think.
It might have been on the border of North Salt Lake, right there. That would be wonderful if you I'm so glad. We love hearing about new good resources, particularly in the behavioral health area. So, great. Oh, thank you so much. Wonderful. Well, we do have this in the portal, so we'll make sure that it's correct and up to date. And it looks like you put it in because of a specific person who works there who responded probably to a survey for us. But what I think we need to do is have hopeful beginnings in there and then list any of the providers that we're familiar with or aware of a little differently. So we'll make the focus of this hopeful beginnings rather than the Manning. So we'll update that. But excellent. Great. Okay. All right. Anyone else before I move on? Yeah, no, go ahead, Paige. Go ahead.
Okay, I have a patient. This might be really simple. They're Hispanic. Just recently moved here. He's disabled and gets an SSI payment. But they haven't been getting it, and Mom, it's only like $80 a month. But Mom, her English is very limited, but can't figure out why, and can't find anybody to call or help her figure out why they're not getting their payments like they're supposed to be. Does anybody know where you would call for that?
Yes.
Yes. They go to they have to go to Social Security Administration and then to the actual office. Number. Go to the office, make an appointment to the office, and get a appointment to do this. Most of the time, you need to be changed from the income. They haven't reported changes on the household income. They will discontinue until they review it and redo it again. So it's kind of like a review like next year. Okay. So that's what they have. Okay. But that child is not born. He is, he is the better child. Oh, okay. He is English. Yeah. The child, yeah. Yeah, that's what she's saying. There you go. I don't think you're trying to do very much. She doesn't work in her husband works part-time. Oh, yeah. She needs help. She's making her own. Okay.
So this is kind of
I was
interesting.
going to also throw something out there. Walt Flores from our office in Spanish, and he works with SI, Medicaid, all of that for years. And I don't know if Walt would be more than willing to allow we could get a maybe one someone over there.
So that's integrated services.
Yeah.
For disability WS.
Yeah.
So that's
And then she got applied for that.
yeah, and it may be because they moved and they haven't like here.
Yeah, she's applied and they have it all set up, and then all of a sudden, quit giving.
Two issues. Your category for Medicaid is $1 of SSI. So you know,
Yes.
Okay, so it's the monthly payment.
Yes. It's because of some question about, I'm sure they send them a letter because they sent them English before they didn't understand. They were notified before they got them.
So do you have a contact to Ms. Walt for us?
Let me give you my,
So is it here?
584-8246 is our program number.
Okay.
And Walt would be happy to kind of help you along this line. Just introduce yourself and let them know you're from this group.
Okay.
And if you his advice, and he'd even be happy to talk with the family. So.
They had a marriage center.
Oh yeah.
He's your first name. And Walt actually comes to these meetings when he's able to work thing. So yeah, so that's great.
He's very knowledgeable with all of that. Certainly willing to help you.
Great, thank you. And then one more resource is we help the families navigate that, and there is a family line. So that's take that and we'll help walk usually get everything so that we can figure out if the payments stop or if they did and make it a letter. One point of clarification for Social Security is if the Social Security office is not PWS, general program, a state grant program. They have to go directly to
One piece is getting the Social Security disability determination means that Medicaid accepts that disability determination for providing the Medicaid services for the child. So they don't go through the normal disability review for the UWS like someone who's not on the sometimes it's lower education.
So this is interesting. So I think I'm thinking about two things. Thing one is Dawn and I were actually just talking the other day about how what do you do when you've got a family who needs interpretation services. So sounds like we have a couple of opportunities in the Utah Parent Center and integrated services for Spanish. Does anybody know of something for other languages, maybe?
So, with if they have Medicaid, linguistic help, will they do like that? If they have to have Medicaid, they just Medicaid for it. And they'll do it on the phone.
Okay.
And it's linguistic and methodology.
I don't think, I'm not sure about that.
Back in the day, it depended on who the ACO was, and you had to find it.
It's true. It's still Asian Association got it.
Asian Association.
I have a lot more language.
Okay. We'll dig into that a little bit, and we'll put that information in our email that goes out after this. Promise?
Some of those used in Utah County are consolidated schools. UIU has a club which has volunteer translators for whatever you need, and that's just called the club, set up the translation with parents trying to they come out, they do a kind of a one-time service that they get and that's volunteer, so it's not always only the but when it's something that is needed, you get meetings, you get nearly every night on that, and UCCCN does the same.
UCU and BYU for Utah County. Okay, great.
Just one more point, anybody that receives federal funding is required to provide that translation services. So like, we just had, I didn't know that there was such a thing possibility, and so we can do federal funding, and so we have to bring somebody in, which is great. We try to do it face to face, because of course so much gets lost if there's no other way.
Yeah, that's definitely good to know. But I think the other piece of it that I've been thinking about is that the time that it takes to make these connections, whether they're phone or whether they're in person, just to set it up and get it moving. So is that something that you guys are doing in your roles, in your jobs? Is this something that you do on a relatively regular basis? That come up and you do take the time to try and help these families through the language barriers for whatever they're trying to get to. So knowing the resources and the processes would be helpful to reduce the hurdles and time barriers. Okay, good to know. Well, we'll work on that. Maybe we'll put a list together of everything we find. Yes?
The Asian Association is something I'd like to know more about for our refugee population,
Okay.
or the Farsi language, such. That's a big deal.
Okay.
You know, the name will almost in itself are saying, you know, Asian Association, because they have some languages. We called them one like Asian. So it was a really big resource for all sorts of. But you wouldn't just think, oh, Asian. You don't call them
Right.
a language act. So.
And,
They're a great place to go.
and I didn't know too that the refugees, they're held by like a host. Who, but then after so many years, that whole support isn't there for them anymore. So then you're hoping you're at a loss at that point. They're not doing it.
What's the resources that we can use? Absolutely need services. Right. Because they have a great outreach. They help them.
Catholic community groups. Yeah, they are. And Asian.
So I have two questions. You know if families will use the integrated services of Medicaid families, will they access them through all your clinics? And my other question is, any of these language services will translate written things, like outreach letters to those families? Or is it only for some?
I know in the past when we wanted something that was translated better Spanish to the well-intentioned gringos we would a lot of times use some of the other programs I think with the and they would charge us like a per word or per line type of thing. So brochures or other information that we can help them, they were able to try to get into some neutral Spanish or neutral culturally acceptable. So but for cost.
Say your first question again, Con.
Oh, I was wondering, do the Medicaid families know that that service is available to them, and do they use it? Do they access them to call your clinic?
Yes.
Only they do that.
Yeah, that's tough. That education component, when there's a language barrier inherent in just communicating the information to then educate.
There's access for language help.
Yes, that's not an easy one, but okay, Linguistica for potentially even writing something out that could be used standardly. They might even be able to, we'll look into that. That's great. Good, all right. Okay, well this kind of segues naturally into our next area. So I really wanted to show you guys what we've been doing with our, got to remember all of my passwords. Let's see if I've got this in with our list. And we've made a lot of progress on these. Nope. I'm just going to use my admin one. So you're going to see maybe a little bit here that you wouldn't see logging in yourself. But for purposes of time, we'll just bypass the many passwords that are floating around in my brain right now and jump here. So you would not do that. So on our main site, the Medical Home Portal, this is now live, and so you may have seen where I went to sign in. That's down at the bottom of every page in the footer. There's a little link down here that says sign in if you're not already signed in. And it also has a location there for you to register the first time. So that's where you would go if you haven't signed in yet to do this and made yourself an account. And I sent out the links in our last resources of the month email, but I'll quickly show you where those links would take you. So this is how you register, and it's a very typical process. It's pretty lightweight, and it's not anything that you haven't experienced doing many of your other online accounts. It's just an email address, and then that gets sent. You get a little auto email in that account that you click on a link and that activates everything. Just a couple of steps is all. And then you set a password and there you're off and running. And this is basically what you would see upon signing in for the first time or registering for the first time. And then you have the opportunity to change your password or email address or those kinds of things. So pretty basic. And again, I'll send these links out. We encourage you to do this. You can't fully take advantage of our list feature unless you've got an account. So that would be first step. And then the second step would be to start creating your list. And so I've seen a number of you that have logged in, registered in the portal, and hopefully are starting to look at those lists. And so we really want to encourage you to do that because we want to continue to make these better and make them helpful for you. And the way that we can do that is by having you use them and tell us what doesn't seem to be working well, what you think should be there, what does work well, hopefully, and so on and so forth. So I wanted to show you on the live site. So right up here on the right, once you're logged in, if in fact you have any lists, you'll see some information there that you can click on, and you can look at the drop-down arrow. It looks like I only have one test list in here, and it's got 6 providers. But I can always start with this little new button here and begin to create a brand new list by searching in our services directory for instance, the Utah Parent Center or Utah Family Voices. And then we can begin to add to that list by clicking on these little pluses. We'll go ahead and put them in there as a parent and family education organization. And once I've done that, you'll see that a provider has been added to my list, and there it is. Once it's highlighted with the yellow in the back, then you know that's added to the list. If I wanted to continue doing that, I come up to our service directory link, and I just can continue to go in, search. We've added a city filter, so for instance, if you know that let's see, give me a place that has a lot of branches. Linda, I'm going to put in DCFS to see if that works. But now I'm going to reduce the number of results because I put in Salt Lake City is where I was searching. And so now I've got right here, and you can decide to put in DCFS for, let's say, child abuse evaluation and treatment. So I'll add that one. Now I've got 2 providers on this list. And they're going to show up based on the category that I assigned them in here. So you can see DCFS shows up under that heading, and you can see the Family Voices shows up under that heading. And now, let's say I want to send this to somebody. Maybe it's a family, maybe it's one of our care coordinators here in this group. So I'm going to make sure that it's, oh, I better name it first. Name it. Definitely name it better than that. And now that I've named it, I have the ability to share it. It needs to be shared before somebody else would be able to access it. I can click on a link, and that allows me to just do a quick keystroke and copy that not very pretty link. And now I could go into, for instance, an email and pop that link in. If you want to make it a little prettier, you could write the name of the list and then add the hyperlink to it so it's not quite so long and difficult. But that would then go to whomever you're sending it. They can click on that list and they will see this. But what they won't have is some of these other options like copy and delete and so forth. To allow them to really manage it and utilize it in a way they'd like to, for instance, naming it something more meaningful for them, adding to it, maybe taking 1 or 2 things away if they didn't find them as helpful as a longer list. Maybe they have a friend who's got some similar needs, they can send it to them, so on and so forth. And so what we're working on right now is the ability for when you register and log in or just simply log in, you'll see a landing page that shows you all your lists, whether they're one that you created yourself or whether they've been shared with you. You can see and differentiate between those two things. So if you're interested in seeing how that's coming along, it's on our test server. So I can't show that to you here, but we're continuing to improve this. And what we really want to do is have you guys use this and let us know if it's useful or in what way that it could be improved. And of course, you can always also print or for instance, save as a PDF and then send as an attachment. If you've got, for instance, a family who needs to receive things in a different way, if you want to print something out and have it ready to go at your office to hand out, those kinds of options are all available in this. So this does require a password and an email. I might suggest that you could think about using a similar one for both the forum and for your list. Unfortunately, they aren't the same account yet, but we hope that down the road we'll make all of this kind of functionality just basically right in one connected, seamless interface. But for right now, the forum and the list would be kind of two separate things. But again, that information will come out in our Resources of the Month email, and we hope that, again, you'll take a few minutes, you'll try this out, and with any luck, it'll be something that's valuable and useful for you. And if it's not, please let us know, because we do want to make this into a very useful tool, and we're going to continue to improve it. There's no end to that. We always improve it. All right. Let's now move to the last part of our meeting today, which is to talk about possible areas of focus for the upcoming year. So we asked you guys to fill out that care coordination survey. Hopefully it wasn't too long. We had some pretty good, a pretty good response rate. We really appreciate that. We sent this link out to you in the emails prior to this meeting, and we're going to take a quick look at that. So hopefully you've all seen this, and I won't take much time to go through it, but you can see by the bars that in some cases the answers to the questions were that yes, most of you are already doing this. But in the cases where we saw a relatively high percentage that, for instance, your practice was not doing something, we thought, well, maybe that's an area that we should focus on. And so we kind of aggregated some of this information into our email and this PowerPoint slide here. And so we hope that you've thought about this a little bit. Hopefully you've talked with other members of your organization about it, because we would like to make sure that in 2016 we're doing things that are valuable and useful and helpful to you. So these were the areas that we saw the potential for some maybe improvement, learning some new skills, learning some new tools. So we talked a little bit in one meeting about pre-visit calls. And because the people completing this survey have done so over a period of months, it may be that some of this has changed for you. Maybe you're doing this now and we're just not aware of it. So that's why we want to talk to you and get your input at this point. So does anyone want to bring up what you'd like to be looking at in 2016? Billing. Okay. Have a vote for billing.
Not that I want to, but our people think that we should be.
That could, in fact, be a meeting that either we schedule out far enough that your office staff can be alerted to that date and can join us, or maybe we even work on it at a separate day and time that works better for that extended group scheduling, so we can try and work on that. And that would be like a different set of people than usually present, who we probably invite to talk with us, who have some experience in the world of billing and coding, right? So, great, yeah, we can do that. Nita. Okay.
But it's so hard sometimes to so that the roles to be answered or different folks that it is required. Equipment or everything.
Okay.
And so a lot of times, if they lost in the process, they don't notify you. You're doing wrong to be a different code. They don't let you know. It's repeat the service. And then when you dig in, you find out it's a different code.
Okay.
And we don't know that. Even the doctors don't know.
Who does know the CPT code? Who? Right. Okay. So you had some success.
Not getting them paid. We've tried building them. I know the CPT code. They don't get paid. Or they haven't been given as of the last time, which was probably that year.
All right, so
I wanted to throw something out there generally, and again, I'm not I think creation of a shared plan of care is an important piece. I'm kind of curious what everybody's doing along those lines. What I think is going to be important just for everybody that offers care coordination services is to be able to document what you're actually doing with families and be able to say, this is how we're saving money, or this is why we think that this is beneficial to the family, or overall it saves the system money. It's all about money at the end of the day for these payers. We able to say, this is how we document, this is what we do. We'd like to be able to show you the data we've collected to justify why we think care coordination is important. I think if the payers were approached by multiple organizations that are doing this successfully and have documentation supported, I think we would have a case.
So if I can add to that, so part of the UCCCN folks that are out there, it's 30 minutes face-to-face, and it's in a 1-month period. So the way it's currently structured is it's 30 minutes face-to-face, and then 30-minute increments, and so you can accumulate time throughout the month, or it's a minimum of an hour of phone communication over the phone. You really have to document your time throughout. So I don't know, if you have answers to this, or people who know answers to this, that would be amazing, you know. I mean,
built into our EMR the ability to create a, lack of better word, you're creating that shared plan of care. We have a way to go and categorize, it's not billing, but we have a way of allocating the time, and it's broken into categories of discussing Medicaid, referring to outside resources, creating plans of family, so different tasks like that. We have 15 minutes in there. So you can put a number of those, and then I can run a spreadsheet and say, in a month, this is how many of these activities we ran. So it's just kind of a cheesy thing we built into the EMR, so we can kind of track this for our own purposes. It's called Cataract, and it's a local developer. So that's why I think we're able to do it, because it's a local developer. It's one of the big ones. The ability to do that is not quite as
I'm sure we can incorporate some of that through the IDA.
So it might be interesting to try and do some research into what's the lowest common denominator for any EMR to handle in terms of, you know, a free form, or I don't know, my terminology isn't great at this very second, but the idea of, based on what we do know, here is something that might be usable in almost any EMR in a very, very basic way, right? And then start to look at what that that very basic thing should incorporate to help track time, understanding, you know, how that connects with CPT codes and so on and so forth. So I've got some things going on in my head, but I know that there are forms and attempts to try and track care coordination activities. And we can look at what Eric and his team are doing. We can look at some of these other tools that exist out there, and maybe we can come up with something that is, again, it's very basic, and then that would allow you and your technical teams to take them and try and integrate them with whatever you're looking at, to just start doing some of those things. It would not necessarily mean a huge quality improvement thing that you would necessarily have to do in your practice. It could probably be something that you do on an individual level to whatever degree works for you, and then you could ramp it up from there. But this sounds really interesting.
I know I'm visiting with Dusty, and they were kind enough to thank you, but I know Dusty tracking the spreadsheet, but I know she's got all sorts of information on her family. And it's kind of low tech, it's not attached to your EMR, but it might be a stopgap measure until you something that you develop that you don't need to use. And maybe there's a good example that can be shared that how we do it, what we do, and collect. So it's a template for other providers or other, care workers.
That's why it'll be interesting to see where this goes. We are looking into it. possibility of billing for care coordination. But we've been seeing that Medicaid, so all patients need to meet certain criteria for us to be able to bill. And it's a lot of steps. It's not just 100% care coordination, but there are requesting diagnosis, prognosis, services offered, resources available. Just a lot of requirements. I think that's the main.
So if we understood what those hoops are, and we could take those fields and sort of populate or make it really easy to say, these were the services we provided. These are the
challenge.
Okay.
Coming up with a standard, for all the kinds.
Right.
Medicaid requires a lot of them.
Did you hear what she just said? A standard for all the practices.
Well,
I think that's an awesome
back to my original thought, though, a shared plan of care. And I mean, I don't think anyone wants to pontificate and say it has to be this, and this order. But I think we might be able to come up with what's a laundry list of things that should be, what's best practice, what would insurance, third-party payers be looking for, and could we reach some sort of a consensus amongst at least the coordination group and say, we think it should include these components, and that would satisfy, some billing concerns. I know there are also some kind of standards out there for certain quality improvements to talk about care coordination. I was on a conference call yesterday with Rhode Island. They sent out a template of something very unique called feeder standards. They kind of talk about shared plan of care should include certain components, but it seems a little bit loosey-goosey, so it's not totally on the straight and narrow, but it says it should include this stuff, and it allows you to latitude to practice, kind of make it happen in whatever format works best for you. I just wonder if looking at that sort of in a group might be helpful. You could say, hey, it's pie in the sky, or this is great, or it's doable, or it wouldn't take too much work to implement something like this. We're trying to get something a little more.
And I will throw out there, we've got to wrap up here, but I will throw out there that there's a state-level group with the Bureau of Health Promotion that is working on a project right now that has to do with care coordination and behavioral health integration. And of course, this is adults as well as children. And they are putting together a survey that will be asking some of these very questions to a wide variety of organizations that do primary care about how they are communicating with patients and how they are documenting activities. So it may be that we'll learn something from what they are gathering as well, because it'll be much bigger than, for instance, this group. So that could be interesting. And I think that's supposed to happen by probably end of March. We would have that. So. Anyway, yeah.
And you're going to share that.
Oh, sure, yeah. In fact, they actually looked at the survey that we put together to help with putting that one together as well. So, but they'll expand on it and ask more specific questions that we didn't get to. Okay, great. I think this is good. I'm hearing a lot of stuff, a lot of meaty stuff. They're really going to come out of one meeting with everything ready to go and perfect, but that's great. Let's see. I know that. Noemi, who couldn't make it here today, had a couple of thoughts. One of her thoughts for this upcoming year was, I think she got very excited at the October meeting with the patient registry population management information, and she was curious to know if anyone was actually using a specific kind of registry tool, is I think what she was asking. And so that might be something we circle back around to if there's interest. Do you remember she had another?
Help me understand risk.
She wants some way of
Track of symptoms.
That's the asthma registry?
Mm-hmm.
Yeah.
So, as part of one of that pediatrics, we're actually working on and seeing that there's one of our care coordinators that following someone
if Wasatch would be willing to share that, I was understanding that it probably is working in tandem with your EFCMR. But if we could see something that's kind of just, really the basic bones of it, that would be really helpful.
To speak on behalf of that Department of Health school program that Brittany was talking about, and then care manager, pediatric care manager that helped me medicate have put together, kind of coincides with each other, but an asthma program. And we started rolling it out. It's just been about a month, but we've had a really hard time with people calling us back for us to go in the home to do this education. So we're giving it like 3 tries, and then where we're going to start taking it is out to the clinic. So that we want to reach out to the care managers and coordinators there to, so that when the next time the kiddo comes in, that maybe we can collaborate on maybe the physician, suggesting and saying, this is what we would like you to have. Something like that to help us reach the kids.
So I have some things, again, kind of rolling around in my head. So cool. Other ways to collaborate. And so I'm hearing not only are you talking about your health plan working with the families and the clinics, but the schools getting involved in that as well, so trying to connect all of those folks. So maybe trying to work a little bit more with the school system and understand what the options are there. Okay.
It's really a challenge. I'm trying to work with schools and getting them to start getting meetings for schools and here I'm in the area. So it's really a challenge.
What I've found is that there might be one thing in terms of a policy, or what should happen, but I think every school is different, and that becomes very challenging. Yes.
So we try to get the school nurse more involved in the uncomfortable application for self-management education. Non-responsive. I think that's really overworked. Because they are so poor at schools, right, or versus
Well, I'm talking about that.
Yeah.
that's primarily I think that's what we have already.
Okay, well, it is 10 o'clock, a minute after. So thank you so much, you guys. Be sure and get validation before you go. And
Did anybody have to get a ticket on their way in? It was broken when I
there were no
my
tickets.
time.